Hello and welcome to our Kauai Health Biweekly webinar. Today is Thursday, July 22nd. My name is Deborah Volison and I'm the Director of Community Engagement, and I'm joined today by Gary Herbst, our hospital CEO. We're going to cover the questions that were submitted, and of course we're always open to looking at chats. But before we get started, I want to just talk about the survey that was sent out yesterday. We have been working on the master facility plan, and we sent out a survey yesterday to all of our community engagement participants, and it's giving you a little bit of history, and it's showing you some ideas that we have for the master facility plan, and it's also asking for your feedback and your opinion. And so there was a glitch when it was first sent out, and several of you reached out to me and said it's not letting me take the survey. The company has since corrected that glitch, and they sent out a second email yesterday afternoon, and they said people were able to do the survey. A couple of you sent me messages saying, I'm still not able. So if you could get back into that, attempt to take the survey again, we would really appreciate it. This is very important feedback that we are going to be looking at really closely as we move into the future and look ahead towards the future facility. And so we appreciate you taking the time. It will take about 10 to 15 minutes, and it's very important, and we appreciate you being engaged in that process. Welcome, Gary.
Yes, thank you, Deb.
Very good to see you.
It's good to be seen. It feels like I've been gone for a long time, but I think since we moved to every 2 weeks, missing one of those is almost like a month being away. So I guess that's what I'm feeling. But good to be back, and looking forward to responding to our community folks' questions and those that I got in advance. And again, as Deb said, I welcome any on-the-fly questions that come to mind, or anything I talk about that might
You actually
trigger.
love that.
Well, I would say I love it, but I'm very willing and encourage that. So.
Yeah. When you were gone, was it vacation?
Yeah, I actually took a week's vacation. First few days, my wife and I went to San Francisco and enjoyed kind of the little chilly 64-degree weather, and stayed down near the Embarcadero, went to a couple Giants games and a couple nice dinners, and then some friends of ours from Fresno joined us, and we drove over to Napa for a couple days, where it was 105 degrees every day in Napa, but that certainly then acclimated us nicely for the return back to Visalia. It probably would have been bad to go to Napa first, then to San Francisco, then back to Visalia. So we kind of played it right, but it was a really nice time off.
Yeah. Well, good to see you. And so let's jump right into it. We're going to cover some COVID questions. You're going to do the numbers, and so let's go ahead and start there. You want to talk about positive cases?
Yeah, and obviously the traditional rundown that I've done, starting at the state level, the county level, and then here locally. Given that we're a year and a half into the pandemic, you probably don't care about the tens of millions of tests that have been done and all the number of cases that have turned positive. So we're going to kind of shorten up on the statistical information I provide, but I still think what I will share with you, you're going to find interesting. So in terms of the number of positive cases here at Kauai, as of this morning, Thursday, July 22nd, we only had 10 COVID positive patients that were in the acute medical center. They're all adults. 2 of them are in the critical care unit in the ICU, and both of them are on ventilators. And we've been holding pretty steady over the last month, somewhere between 10 to 14 patients. We actually got down all the way to 4. We only had 4 positive cases, and rarely did any of them end up in the ICU. So that's very, very encouraging, particularly at a time where we are hearing that across the rest of the country, particularly in the Midwest, they're seeing a very marked rise in the number of COVID positive hospitalizations and deaths. So we certainly hope this isn't the calm before our storm, but we're keeping a very watchful eye on what's going on in other parts of the state and the country. In terms of the number of positive employees at Kauai Delta or Kauai Health, over this entire pandemic, we've had 1,206 of our employees that contracted the virus. Of these, 1,187 have now recovered. Sadly, 3 of our employees passed away over the course of the pandemic. And we still have 16 of our employees that are out on a leave of absence, a COVID-related leave of absence. 11 of those 16 actually have been out since 2020. But then we just, this month, we had 5 newly diagnosed employee COVID cases that they are now quarantining and are at home. And then lastly, we continue to be an incredibly busy hospital, which is a bit befuddling because it's July. Usually the summer months are slower. We're not in respiratory season. Certainly our COVID numbers are down. But our acute medical center right now is 91% occupied and has been running at that very, very high level really over the last couple months. Of our 41 ICU beds, we have 13 that are unoccupied, so that's good. We have some critical care elbow room. But with respect to our 54 intermediate critical care beds, 11 of them are open on 3 West, but if we were to admit patients into them, that would create a double occupancy situation. So there are only 19 rooms on 3 West, but 11 of them are often double occupied, but we've been trying to keep them single occupancy, and if you look at just single occupancy, then there are no available beds whatsoever in intermediate critical care. And then I think what's most disconcerting is we only have 8 of our 249 medical surgical beds are currently available. At least that's as of 7:22 this morning. And of those 8, 6 of them are on the pediatric unit, which we're using as an adult overflow unit right now. So very, very busy, but every day we're discharging dozens and dozens of patients, making room for others. And in fact, this morning, my daily email, our emergency department continues to be very, very busy. We had 27 patients that were back in exam rooms, and of those 27, 21 were waiting to be admitted into the acute care hospital, waiting for a bed to open up. So every morning there's a flurry of work that goes on in the ED and up on the nursing units to work with our hospitalists, other physicians to expedite safe discharges, but to try to open up beds and keep that throughput going.
Okay. So a burning question that we are getting is about the Delta variant.
Yes.
So are we seeing the Delta variant in our hospital?
So we are not at the hospital level able to make that determination. So to be able to, what we do is we test for the presence of COVID. And we, again, as you've heard from me, we have multiple laboratory platforms that we can run to detect the virus, highly, highly sensitive laboratory equipment. But it doesn't tell us what strain of COVID it is. That can only be determined by doing DNA sequencing, which is a very sophisticated laboratory process that's generally done at the state level. I'm not even certain if the county laboratory is able to do sequencing, but we do take our samples of COVID and we submit those to the county, and either they're able to do the DNA sequencing or they send them to the state. It has largely been the state. The county has definitely reported that the Delta variant is here. And the CDC and other federal agencies just recently reported that 83% of all the COVID cases in the United States are now the Delta variant. So it's highly, highly probable that the Delta variant is quite present here in Tulare County, and probably a high probability that those that are hospitalized, those 10 patients at Kauai, do in fact have the Delta variant.
Okay, but the vaccine is effective.
Yes, it is. It's really interesting. You've heard me say in the past that the vaccine was developed not to prevent you from contracting COVID, but to prevent you from becoming really ill, severely ill, hospitalization, and death. And it is incredibly effective, even against the Delta variant. Again, the CDC and the federal government is reporting that 98 to 99% of all COVID patients that are hospitalized right now are unvaccinated, meaning that Pfizer, Moderna, Johnson & Johnson, those vaccines are still proving to be very, very effective in preventing hospitalizations and death. But what we are seeing are more and more of these breakthrough breakthrough viruses, cases, where people have been fully vaccinated with one of those 3 vaccines, but they now are contracting the virus, and probably most likely the Delta variant, which is proven to be much more transmissible and can make people much more severely ill when they do contract it. So it's been interesting to see, because I think before the Delta variant came along, scientists and the drug companies, while they never intended the vaccine to prevent you from getting the virus, they were finding that it was pretty effective at completely preventing you from getting the virus, even a mild case of it. And if you did get it, the likelihood of you transmitting it was very, very remote. But now with this Delta variant, we are seeing more people that were fully vaccinated that are contracting it, but none of them are ending up being hospitalized. We've been following the story about what's going on in Texas with the voting debate and everything, and the Democrats leaving the state. Well, 6 of those state Democrats fully vaccinated contracted the virus and have tested positive for it while back in Washington, and now have spread that virus to other folks as well. And that's the big concern, that unvaccinated people, still only 37% of the Tulare County population is vaccinated. And that's, we're one of the lowest vaccinated counties in the entire state. And so you have this huge population of unvaccinated people at a time where this very transmissible, more powerful Delta variant is floating around. And now even fully vaccinated people can contract it and potentially, transmit it to an unvaccinated person. So I read a lot, it is a personal choice to get vaccinated or not, but that personal choice does affect other people. So I'm going to continue to be a big advocate, for the vaccine. We see a number of hospitals. St. Agnes Hospital in Fresno just recently announced its decision that it's going to make vaccination mandatory for all of its healthcare workforce by September. We're not going down that path at this point. We certainly are watching what other hospitals are doing across the country. It was interesting to see somebody so local adopt that, although St. Agnes is owned by the Trinity Health System out of Michigan, so that could be a decision that was more made at the corporate level. But again, we want to protect our employees, but just as not more importantly, we want to protect our patients. And the last thing we want to do is to infect an unvaccinated person that ends up being hospitalized.
That would be difficult too in this culture of being short-staffed.
Oh yeah, we currently have 530 open positions right now, probably the highest level that I can ever remember. 130 of those open positions are bedside nurses. And so we find ourselves as an industry once again facing a severe nursing shortage at the local level, the state level, the national level. This pandemic has had a huge impact on the healthcare industry. Many healthcare workers, physicians, nurses, others, simply deciding to get out of healthcare, that felt it was just too risky or they need to stay home and take care of a child or an immunocompromised adult or other loved one. So it's already really exacerbated what was already kind of a nursing shortage that was more intense in the San Joaquin Valley.
Right. Okay, so I know you referenced it, but I just want to make sure that we answer the question. So of the 10 people that are hospitalized right now, have any of those patients been fully vaccinated?
So I don't know that answer, and it's an excellent question. We have never, throughout the pandemic, have ever, upon admission of a COVID positive patient, we haven't asked them, have you been vaccinated, and if so, when? Or have you contracted the virus previously, and if so, when? So that hasn't been part of our regular admission routine, but we want to make it a part. We think that is very valuable information. And so just yesterday, we had our COVID section chief meeting, and I was directing our folks to begin modifying our electronic health record system so that we're able to capture that information at the time we admit a COVID positive patient. Because, and I'm personally curious about it, because everything we read, everything I've read about both the vaccine and natural immunity is that they believed it had a 6 to 8 month immunity period. Well, most of us got vaccinated back in December, and that would be 8 months ago. And so is that what we're seeing out there? Is the Delta variant really just so strong, or our fully vaccinated people are starting to see that their antibodies are starting to diminish the effectiveness of it, and that's why you have the drug companies talking about a potential booster shot. And so I think it'd be valuable information to see if we're seeing COVID positive patients being hospitalized that have previously been vaccinated. When were you vaccinated, or did you have the virus before? So we are going to start collecting that information.
Okay, thank you. So we addressed this several months ago, but it has popped back up on social media. And according to a poll conducted earlier this month with a sample size of 1,500 people, 20% of these poll takers believe that there is a microchip in the vaccine.
Right.
What is your response to that?
I don't mean to chuckle, sorry. I'm not disparaging those 20% that were tested. But yeah, Deb, you're right. I did, this question was posed to me many months ago. I think it was shortly after the vaccine was starting to roll out. I think it was in that same telecast that I was also asked about aborted fetuses. And so I had done some quite a bit of research back then, trying to figure out what's the origin of this belief that there's a microchip, and I did see some, not validity to it, but I understand where it's coming from, because there was the belief that Microsoft was actually behind the whole microchip drive, and that Bill Gates was personally funding it. So my research just uncovered that Bill Gates is in fact investing $1.75 billion in trying to develop new technology, new ways of tracking vaccinations of all kinds of diseases, and particularly in developing countries and those countries that have poor healthcare infrastructure than you might find in more developed countries, like the United States. So scientists with Bill Gates' financial support are trying to create what's called a biocompatible near-infrared quantum dots delivered to the skin by microneedle patches. And it's essentially like a tattoo almost, that you're able to literally embed the person's vaccination record into their skin. It's invisible to the naked eye, but then if you pass like a smartphone over it, you can see if a person's been vaccinated for measles and smallpox and coronavirus. And So that was the intention, is to help develop that, but it's not injecting anything into you. And I was reading something out of the Atlantic Journal. It'd be physically impossible to place a microchip in a single injection. Remember, the vials come with like 6 doses in each vial. So to be able to draw 6 doses out in the syringe and drop a microchip in there that would fit through the gauge of the needle is very thin. It's not like when you donate blood, which I think is a 16 gauge needle, but it's a very small gauge, very thin, and no microchip that would have any value, that would be able to have the energy to operate, but then be able to transmit, or it's just physically impossible. That technology does not exist, and I don't know if it ever would exist. But Bill Gates did this interview, and he made a comment that he sees one day, we would all carry a digital passport of our healthcare records. But he did not suggest that it would be a microchip of any kind. It would be more of an e-vaccine card. And apparently, the very next day, these websites just went nuts about Bill Gates funding microchip deployment. So I'm not personally one of those 20%, so I don't believe it. But
well, and a little history on Bill Gates. The Bill and Melinda Gates Foundation has been instrumental in helping eradicate polio.
Yes,
with the help
absolutely.
of Rotary. So his thinking behind that is, when we go into third world countries, that these children, they have to make sure that everybody's vaccinated. And so I had known that before I read about the microchip, but if you are suspicious of the vaccine,
right,
that just plays into that.
It does. I mean, we know there's a lot of conspiracy theories out there and everything, and technology can always be used for good or evil.
Right.
And I think about, so if I had the opportunity to have a microchip implanted into me that had my entire medical health record, all my underlying comorbidities and the medications I take and things like that, and I happen to be in a trauma, a terrible car accident, and it didn't happen in Visalia. So I get rushed to the emergency department, they scan over my microchip, and they know everything about my health, and it could save my life. So Deb's shaking her head no. But that's because you're worried about how it could be used for evil.
That is right.
No, I got it.
That is right, and I am against being identified that way.
Okay.
No, but it's interesting, and the question is valid, and obviously 20%.
Do you have any problem with your dog getting a microchip so he never gets lost?
No, I don't.
Okay.
And do I believe my dogs go to heaven? Yes, I do.
Okay, all right.
Okay, so let's move on to masking. So the American Academy of Pediatrics is recommending schools require face masks for children older than 2. And I believe this is the case with Visalia Unified School District. Our children will be going back to school masked while they're inside. Okay, so Dr. Fauci told CBS this morning the Academy wants to go the extra mile to make sure kids are protected at school because of the rise in cases of the Delta variant. However, this differs from the CDC, the guidelines that have advised mask wearing in schools just for unvaccinated children and unvaccinated adults. And Dr. Fauci's looking really carefully at the CDC guidelines, but do you think we're headed, here at Kauai Health, masks are no longer required for employees in non-clinical, if they are unvaccinated, in non-clinical areas.
Yes.
So do you see us going back?
Yeah, great questions. Crystal balls, So, yeah, the CDC came out on July 9th, specifically their guidelines around students and children. And as you said, their guidelines, their recommendations is that all unvaccinated students should wear masks while indoors, and that vaccinated students do not need to wear a mask while indoors, but they still endorse social distancing of at least 3 feet. So here you have the CDC saying only unvaccinated students need to be masked while indoors, but you still have to practice social distancing. Then 3 days later, on July 12th, the California Department of Public Health issued its guidelines. And it said all students age 2 and over, while indoors, must wear a mask, vaccinated or unvaccinated, but that you don't have to practice any social distancing. So according to California Public Health, you don't have to worry about that 3 feet, but everybody has to wear a mask while indoors. And then I think it was on Tuesday night, Tamara Ravelin, who's the superintendent of the Visalia Unified School District, sent an email out to all parents that by law, the Visalia Unified School District has to follow the California Department of Public Health guidelines, which means that all children, all students, irrespective of their vaccination status, would have to wear a mask while indoors, which is what the American Academy of Pediatrics is advocating as well. Now, also on Tuesday, the Tulare County Board of Supervisors passed a resolution a unanimous resolution that essentially is leaving it up to local school boards to decide what COVID-19 safety protocols they're going to follow, and to very much involve parents in that decision making. So where we're headed, I think, at least with respect to the Visalia Unified School District, I think they've pretty much informed us where we're headed, and that's to follow the California Department of Public Health, and that all students will wear masks while indoors.
And it's one thing for our Board of Supervisors to say, do what you want to do. It's another thing if you're receiving state funding.
Yeah, and if you're a school district that's saying we're required to follow the law, we're required to follow the CDPH. When you talk about, CWIA has been the same way.
Right.
We've been following CDC guidelines. We have to comply with California Department of Public Health regulations, and we have to comply with Cal OSHA. And sometimes Cal OSHA, which oversees employers and the workplace, doesn't necessarily agree with the California Department of Public Health. Mm-hmm. So as Deb mentioned, it was just recently, just probably 2 or 3 weeks ago, where Cal OSHA and CDPH clarified for us to the point we felt comfortable implementing this. But now, fully vaccinated CWIA health employees, if you are not in a building in which health care is provided. So we're right now in a building off campus, in a conference room, our studio, and all of us are vaccinated. We don't provide patient care in this building, mm-hmm. so we're permitted to not wear a mask now. If any of us were unvaccinated, that person would have to wear a mask. But my office is located in the acute medical center. And so even though my office, we don't provide patient care in my office is in a building that we provide patient care, and as such, I have to wear a mask. So when we meet in our conference room, even though we're all vaccinated, we all have to wear masks. And that essentially is dictated to us by Cal OSHA. Mm-hmm. We think it's a little extreme. Yes, healthcare is provided in the building, but not in the executive conference room. So you would think they would make exceptions to that, but they haven't so far.
So when we say we're watching the Delta variant closely, and people have asked me this, what is your trigger to where you start getting concerned about it? Is it the number of hospitalizations, or is it the number of positive cases? Because if you're vaccinated and you get COVID, a high probability you won't be hospitalized.
Right.
So is that worrisome? Or are we just, it's something we just watch?
Yeah, for me, it's definitely the hospitalization that is concerning. And right now at 10, I don't think we're concerned. It's just become part of our normal day-to-day, operations, taking care of a COVID positive patient. And it's been a long time since we had a death from COVID in the hospital, or again, we get better and better at taking care of COVID positive patients. What's been interesting, I looked at our dashboard yesterday, and it used to be that 75% or more of all our hospitalized COVID patients were age 65 or older. We are seeing a younger population now that's being hospitalized, and it's because it's the younger population that's unvaccinated. Even though Tulare County only has an overall vaccination rate of 37%, those that are age 65 and older, that vaccination percentage is significantly higher, probably double that, if not more. So now you've got the vaccine that's essentially, or the virus that's feeding on the unvaccinated, which tend to be the younger, population. So, and what does concern us is that, again, back in the Midwest, where they have even higher percentages of unvaccinated people, that's where you're seeing the rise in hospitalizations and the rise in COVID-related deaths. We still struggle, as we talked earlier, about staffing, and so oftentimes when we're shorthanded, we contract with nurse travelers to come fill those spots. It's increasingly difficult to find a nurse traveler because they're all deploying to the Midwest. And so the fear is, if this rolls out like it did originally, you might remember the real breakout was New York and New Jersey and Louisiana, and we were watching patiently here on the West Coast and weren't really experiencing anything. And it just kind of rolled east to west. And we definitely, California then became, a real hot spot while things were kind of simmering down on the East Coast. So the fear is that it's this new resurgent, this Delta variant, starts making its way west, and all the resources are now still back in the Midwest, and we really struggle. I'd love to, unfortunately, only about 55% of our healthcare workers are vaccinated right now. I wish it was a heck of a lot higher than that. I want them to be safe. I want them to come to work and take care of our community in the event we do have an outbreak. And I'm watching what's going on in Fresno. We talked about, I'm jumping ahead a bit on one of your questions, but do you see us moving into, not lockdown, but LA County just, a few weeks ago announced that it's now mandatory that all residents of LA County, vaccinated or not, you have to wear a mask when you're indoors. Fresno County is really contemplating that now, and that's because they've seen a significant rise over the last couple of weeks in the number of hospitalized COVID patients. They reported, I think they've got 72 infected patients right now are in Fresno hospitals, 15 of them in the ICU. And while we haven't seen a similar increase in hospitalizations, we are seeing more COVID positive cases being reported by the county. In fact, just yesterday, the county reported that we had 68 new COVID positive cases that were identified yesterday. So that translates into 14 per 100,000 population. You remember those numbers I used to talk about month over month? If we were at 14, we'd be back in the purple tier 1 when we had, the blueprint for a safer economy. So that positivity rate, the number of new daily cases in Tulare County is rising. Again, we're not seeing it in hospitalizations, but hospitalizations and COVID death is the lagging indicator. You generally don't get hospitalized until several weeks after you've been infected. And you start, experiencing that acute respiratory failure that ends up putting them in the hospital. So, so we're remaining, highly alert. Again, we've learned a lot, ample supply of, monoclonal antibodies and PPE, and, we stand ready to jump in if necessary, but yeah.
Okay, so is there anything else you feel like we need to talk about with COVID that maybe I've missed? Any other burning topics that?
Gosh, I think we about covered it, so.
Okay.
Yeah.
So let's move over to the CMS survey.
Yes.
We have talked a few times on our webinars that we were in the middle of an intense CMS survey. So why don't you give us an update on that?
Yeah, so the what's called a complaint validation survey was conducted by the Centers for Medicare and Medicaid Services, so that's the federal government. Although they used state surveyors from the California Department of Public Health to actually conduct the CMS survey. But it occurred at the end of March. They finished on April 1st, they left. And then on May 12th, we received their report, their statement of deficiencies, often called a 2567 report. And we were given about 10 days to prepare a comprehensive plan of correction, how we would respond to all of their findings and the changes that we would make relative to the prevention or more timely detection of drug diversion, which is what led to that CMS survey. So on Friday, July 9th, our final plan of correction was fully accepted by CMS and by CDPH. And then on Monday, only a weekend apart, we had 4 surveyors from CDPH that arrived at the hospital to do essentially a validation or verification survey to confirm that everything we said we were going to do, all the changes in policies and practice and audit tools that we would put in place, and safeguards and locking and securing syringes and wasting propofol and other medications, and chain of custody in terms of handling of opioids and other medications. So they came out, they spent a whole week and a day, and at noon on Tuesday, so just two days ago, I had the delight of sitting in the room and hearing the words substantial compliance. And substantial might sound less than perfect or ideal, but that's the highest level of compliance that CMS awards, is substantial. They don't expect you to be perfect 100%, but to be substantially compliant, and with what they call the Medicare conditions of participation. So we achieved that this last Tuesday, and again, music to our ears to hear those words. There were a few minor things that they said we could kind of tweak here and there, and so we'll get started on those right away, and they're pretty simple things to address. But we don't expect them to come back. They don't need to come back and resurvey for these minor things, and we now have had what's called our deemed status, which is CMS deems you to be compliant. That's been fully restored. We definitely learned a lot through this process. I think we are a safer organization today than we were before relative to protecting the safety of our employees and our providers and our patients. Sadly, drug addiction, alcohol addiction is highly prevalent across the country in the healthcare industry, largely because they work in very stressful, complex jobs. They work long hours, and they have easier access to opioids and other kinds of drugs. So hospitals have to be very vigilant and go above and beyond in their work environment to prevent that from happening. So I think we've, while it was an agonizing process in many respects, again, we took it very seriously, and again, I think it's made us a safer place, and definitely has elevated just our conscious, in terms of being alert to diversion and, consciousness is what I meant to say. But yeah, just being, more attuned. Because the two individuals that were involved in the drug diversion, they're beloved members of this organization, and sadly one of them died of an overdose from diverting the propofol, and so it's had a traumatic impact on our organization. Our folks in the ED, this individual's colleagues, are still mourning his death, and it's going to take them a long time to get over it.
And just to remind everybody, we reported it in December.
We did.
This was a self-report.
Both of them. When we learned of the diversion in December, we reported it immediately. When we learned of the other diversion in January, we reported it immediately. But because they were on the heels of each other and we had a death, that caused the state to then contact the federal government, and that's what triggered the CMS survey.
Okay. All right, so moving over into another burning question is the ED. When are we opening? Do we have any? I know we have, we had the inspectors, we did the plan of correction on that, and are we still just waiting for them to come out?
Yeah, so unbeknownst to me and to us, we didn't realize that there was a link between the approval of opening Zone 5 of the ED and this CMS survey and this propofol diversion and death issue, which did occur in the ED. So right on the heels of the CMS survey is when we had the survey of Zone 5 of the ED. And as you indicated, that survey went amazingly well. They found only a few minor things that were technical in nature. We fixed them immediately. We took photographs of them. We sent them to CDPH, and then we waited. But we waited and waited and waited. And, not wanting to be pests, but we were calling and basically being told we're not ready to grant approval yet. But then in June, early June, I had a conference call with the director of the Bakersfield field office of CDPH, myself and Carrie Nowesky and a couple other folks, and I flat out asked her, listening to her, I said, it sounds like you're withholding approval for opening Zone 5 because of this CMS survey. And she said, yes, that's correct. Well, that's the first time they'd ever come out and said that. And I said, so what is the concern? The concern is that you are understaffed. They believe that propofol diversion event, which also involved, nurses and residents and supervising physicians, they believed incorrectly that we did not have enough physicians to supervise the residents working in the ED. And so over the last several weeks, independent of the CMS survey, we've been negotiating with CDPH and demonstrating to them that we do have adequate staffing, that we, at the time of the diversion, that we more than met the required ratio of faculty attending physicians to residents. But until we were able to convince them of that and prove that through their survey and now this follow-up verification site survey that they did, I think they're now satisfied. Now, one of the things, there's no doubt about it. I won't try to sugarcoat this or anything, but staffing is a challenge right now, no doubt about it. Not on the physician side, but more on the nursing side and the tech side. And that's house-wide, as I mentioned earlier, but also the ED. And so once we're approved to open Zone 5, if we could open up all 6 zones of the emergency department, we'd have 73 exam rooms. We don't have enough nurses right now to staff all 73. But that's not what we're asking of the state. We have enough staff today, although we have many more staff that are in the pipeline. We do have more travelers coming. We expect to get to full staffing of the 73. But if you were to look at us today, we could staff 57 of those beds. So I'm not asking to staff 73. I'm saying let us open the brand new, shiny, state-of-the-art 24-bed Zone 5, 3 triage rooms, 100+ seat waiting room, designed with highly efficient throughput. Let me open that, and I will close 2 of the zones in the older part of the ED, Zone 6 and Zone 3. So I will only staff the number of exam rooms that we can safely do and be compliant with the regulatory staffing ratios. So that's what we're trying to bring home with CDPH. Now having, finalized the CMS survey and met the substantial compliance, I'm now hopeful that we will now get the green light. I actually have a phone call today at 4 o'clock with the head of CDPH, the Bakersfield office, who we're working with, and I'm hoping that I will hear good news during that phone call.
Oh, that would be great.
That
would be great.
It would be great.
Yeah. So Gary, we've come to the end of our questions.
Gosh,
I know,
yes.
We've got time. But I want to just reiterate what I said at the beginning about the Master Facility Plan survey that was sent out to all of our community engagement members. It's going to give you some information. This is not new information. If you have served on our advisory committees and our ambassador groups, we've been talking about this for several years, and so we appreciate those of you who have already taken the time to take the survey, and we encourage the rest of you to just spend a little time and give us your feedback. Do you have anything to add about that?
I just want people to know that we're still very much in the study phase of this. No decisions have been made. What we're actually trying to do through these surveys, and then we held focus groups in the coming weeks. I'm going to be meeting with different stakeholder groups, more just to give them general education, just help them understand the master facility process that we're going through right now. But the board hasn't even decided, which option it would pursue, what the time frame might look like. We have been talking about a general obligation bond, but I can tell you at the earliest we would ever consider that would probably be the November 22 general election, which is almost a year and a half away. There's a lot of work that needs to be done between now and then. I literally will be going on a road show with our team here, trying to meet with almost tens of thousands of the people that live in our community and voters, and this is just very preliminary feedback gathering. The board has asked us, as they try to come to their decision about what they think is the best option to pursue, and again the time frame, they want to do it with some sense of what is the community thinking right now. So we're just trying to provide them some perspective from the community. So we've been doing it with our employees, doing it with our physicians, reaching out to all of you. So just echo Deb's ask is that if you can, it's a pretty short survey, but we welcome your feedback, and I know you guys you're certainly much more informed about what's we've been working with you for over 3 years now, but we still want to and we've heard a lot of your feedback, but as things start kind of taking shape, definitely want to continuously be in front of you and getting your feedback. So and you don't just have to do it through the survey. You know how to get a hold of me and Deb, and so anytime you got a question, a comment, you want to share an idea or perspective, we very much welcome that. So again, thanks for being here today. It's good to be back, and hope everybody is enjoying their summer, and again, stay safe out there, and encourage family and friends to get vaccinated. They're quite available still. Disappointingly, I heard yesterday during our section chief meeting that our various clinics were only seeing about 1 vaccination a day. So it has really died down, no doubt about it. And the folks that wanted to get vaccinated, I think, are vaccinated. I don't know how many people are still on the fence, but I'm going to keep encouraging them. And if you feel the same, please do so. So thanks, and have a great coming weekend.